Guys, this is Ryan from Athletic Conceptual Training. We're serving the Livermore area, and we really want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content, and we got more coming. We're one of the fastest growing company in the Bay Area, and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see you soon. Hey guys, this is Ryan from Athletic Conceptual Training, and we're here with another great interview as we dive inside the life of a veterinary hero. Today, we have Amanda Dennis. I have Edie Ford again with us to help us with this group interview, and of course me, Ryan. So we're just going to jump in and kind of get to know you, Amanda and Edie, and just kind of talk about the field. And I have some questions.
Sweet.
Amanda, this one is for you. So tell us what brought you to the field to start with.
I kind of came into vet meds later, kind of in life. I had kind of a series of events when I was younger, just kind of messing around, and decided that I wanted to try out vet med. I was almost 30. I grew up in a house with a orthopedic surgeon and a PA.
Oh, wow.
My dad was an orthopedic surgeon. My mom was his PA. And I grew up in their office, literally grew up in their office. I was in a playpen there from right after I was born, and then was there every summer after school every day. I used to watch their minor surgeries and when he put casts on, and I always liked medicine, but humans were a little, a little rough for me sometimes. And
Really? Well, I really admire your ability to step into the animal field and um, give us all of that wisdom that you've learned and that your parents have given you time and time again. Um, I think all of our furry friends really appreciate it, and I appreciate the work. I've worked with Amanda before in the past, and she's done such a good job. And we're thankful for you being here with us today.
Thanks. Thanks for having me.
Yeah. Again, like having as many people, veterinary professionals as we can, on this movement is gonna boost the field, and it's gonna promote us in a way that we want. And again, thank you for having us. Edie, what about you? I know we touched on yours a little bit earlier, but do you want to elaborate a little bit more on what brought you to the field and some of the things that you're excited about?
Absolutely. So just touching base a little bit farther into previously, when I was younger, I was also more interested in human medicine. And I actually sought out an RN program initially versus vet med, and learned that I pass out at the presence of human blood. I did learn that that doesn't affect me in vet med, for whatever reason. There's a difference there. So kind of being able to amend my passion for medicine. I also had a younger interest as well. And it's kind of neat to hear that you grew up in that kind of environment, because I didn't know that about you. And that's really cool. That's cool to learn.
Yeah.
And it explains a lot about like your natural tech ability that I've been able to see, as well as like your sought after tech skill as well. I definitely had to kind of take what I could do and put it towards the species that I could actually work
on. Circling back to you, Amanda, was there a specific moment or animal that made you realize you wanted to work in the veterinary field, aside from working with your mom and dad? And
well, I did have about 20 feral cats.
Oh, wow.
That I was taking care of.
Well, tell us about that. How'd you get 20 feral cats?
We were living in the country. My parents had built a house out in the country. Okay. And it started out with like, I don't know, 1 or 2 cats. And then, of course, as things often as things often happen, more cats were had.
Yeah.
And we ended up probably about maybe 20 of them. They were all named.
Okay.
They were all my babies.
Yeah.
Yeah, and so I mean, I've always loved animals. I was always
Yeah.
lucky to have a lot of animals in the house and stuff like that. So, but nothing that like I guess maybe drove me towards veterinary medicine.
Okay.
I think it was just kind of something that I kind of almost fell into, I guess maybe.
Hmm.
I don't know. So
Seems like more or less you always had the heart for it, but you were just kind of called to
yeah,
be in the field and found your opportunity, and then like
yeah.
it
I
just
mean,
fit.
I think I just did it. I mean, I honestly don't think I realized that it was a job to begin with, and then I was kind of trying to figure out, what I wanted to do with my life, and I think I found like Western Career College maybe online,
Okay. Yeah.
and went in and they like signed me up that same day.
Yeah.
So
Yeah.
yeah, and here I am. So,
I
That's
did the
awesome.
same thing, the same program. It was one of
mhm.
those
Yeah.
spur of the moment kind
Yep.
of decided to apply just to see if I could get in,
Yeah.
and it was actually the same school after it was Western Career. After
Yes,
it turned into Carrington.
Yes,
I
we-
I
love
remember
that
that. It's
commercial.
the same, it's the same program,
Yeah.
a little different now, but I think I was very similar where I applied
Yeah.
in it, and within a day or so,
Yeah.
Yeah.
the counselors had me sign up for classes.
Yeah,
Well-
they're good. They're good.
Yeah, they're really good.
I mean, seeing both of your talents, Western Career College prepared you both to be an amazing nurses in the field. So,
I appreciate you.
Amanda, walk us through a typical day or night shift for you.
Well, I mean, when I come on shift, I usually like to kind of circulate around the room. I like to look at all the cages, see who's here, poke around. I like to look for cuties,
Yeah.
and just kind of see what's going on. I like to do a lot of my own kind of research in terms of what my patients are, what's going on with them.
Yeah.
I go through an entire record, sometimes before I even get to work.
Yeah. Very
Because I like to know everything. I don't want to miss anything. And the more people that know all the information about a patient, the better.
Yeah.
And so, I spend the first part of my shift, getting to know what's here. And then, sometimes it's a little crazy. So, you got to kind of jump in
Yeah.
and help out, wherever you're needed. So, I mean, I've only done ER. ER is my passion. And so like that's just kind of living that kind of fly by the seat of your pants kind of thing.
Yeah.
Is my thing. So I don't know that there's like a exact kind of routine that I would have because
Okay.
it always changes.
Yeah.
So
Yeah. Posing this question, just for all the people who don't know, what is a registered veterinary technician in your terms?
it is, well, I mean, a vet tech in general is, I consider to be, I'm a voice for animals. I'm a voice for my patients. A registered vet tech is someone who put in the time and the effort into learning as much as I possibly can about how to be the best possible advocate and voice for them.
Yeah.
And I get the privilege of being able to help induce anesthesia and do things like that that only a registered vet tech would be allowed to do or was allowed to do.
Yeah.
But yeah, I mean, I'm their voice.
Awesome.
So
Yeah, I love that. That's something that I resonate with as well, and I really love about the field is being able to speak for the beings that can't speak for themselves, and paying attention to those small little cues and details, whether they're sad, they're hurt, they're happy, they're
Yep.
hungry. Paying attention to all those things is something that we become in tune with, and yeah, that's just
think
amazing.
reading
it's a privilege.
That
So.
and learning the context clues, I think, has
Mhm.
been both helpful in this field and at home,
Yeah.
right? Like it helps you if you can read a dog's body language and figure out
Yes.
if they're hunched over, they're painful,
Yeah.
and we can see that they're painful. you can kind of take that and apply it into your regular life too,
Oh, yeah.
with your own pets and with people.
For sure.
Like you can read body language a lot more like easily. And I will say, like, I've never really been I wouldn't say I'm a huge people person, not so much that I don't like people, but I have a hard time connecting.
Yeah.
But it has helped a lot with that as well, in kind of adapting and learning how to read different types of people.
Yeah, I agree. I feel like it's just a superpower we get to put in our tool belt.
Yep.
Next question. What's one of the most heartwarming cases you've experienced? And on the flip side, what's one that has been the toughest?
I mean, there's a lot of heartwarming cases. I always say that I have this heartwarming story about this cat who she had kind of she was a larger cat.
Mhm.
She had some issues in her neither regions, and she wasn't able to clean herself, things like that. Beforehand, we had ended up sedating her to help get her clean and get her all stitched up. And beforehand, she was pretty crabby. And when she woke up, she was the nicest cat.
Oh,
I was like,
yeah.
like, and it
Yeah.
just, like, I'm like, because, like, and that's the thing, like, where their voice, like, they can't tell you that, something's bothering them or whatever, like, and you help them, and it's like,
Mhm.
just, amazing. And,
Yeah.
heartbreaking. I mean, there's, unfortunately, an emergency, there's, 5 million
Yeah.
stories. But, definitely for sure, it's hard to watch, it's hard to see patients that are something fixable, that we can't always do because of, a lot of different reasons,
Yeah.
finances, or just, kind of what they're able to do, things, any of those kind of things. It's hard to see, things that I feel like I can fix, or, even things that, a young pet who has something that you normally don't ever see in a young pet.
Yeah.
And
Yeah.
something that's not always fixable. And, you want to do right by them, right? Like you don't want to push past, something that, or make them, kind of make them be in pain more than they have to, or something like that. So you have to make decisions, and it's a young pet, or a sweet pet, or I mean, any of those kind of things. I mean, all those are hard.
Yeah.
I don't know that I could give you one in particular.
Well,
So,
along those same lines, how do you stay emotionally grounded while dealing with emergencies, life or death situations, and pet loss?
compartmentalizing for sure.
Yeah.
You have to be able to. But the other thing is, as I consider what I do to be a privilege. A lot of people are like, "Oh, I don't know how you are able to euthanize things, or how you're able to." I'm, I'm. It's my privilege to take an animal, an innocent being, out of pain.
Yeah.
I agree with that.
It's not. I don't see it as something bad. Um, there's absolutely days where you see horrible things,
Mhm.
things that make you just want to never come back to work ever again. But the thing is that you see those horrible things, but also, why would I want to be able to be there to help that pet through whatever horrible thing
Yeah.
it had, or the owners, or things like that. And I have to kind of put past my feelings about stuff like that. And I feel them. I cry. Um, I yell. I, do any number of those types of things. But um, but I know that what I'm doing is more important than kind of letting my emotions take over to the point where I'm, taking myself away from doing something that I know that I'm good at, and that I am helping.
Yeah.
So,
I agree with that. The work is more important than what you're feeling in that moment,
Mm.
because it's not about you in that moment. It's about whatever you're doing.
Yeah.
And especially touching base with euthanasia, I agree with that. A lot of people, that's always everybody's first one. Oh, I couldn't do what you do because you euthanize dogs. A lot of the time, euthanasia is an act of mercy.
Yeah.
You're helping take a case
Yeah.
that doesn't have a happy ending.
Yeah.
And you're helping ease them and giving them dignity
Mm.
on their way out. And
Yep.
I think that's something a lot of human beings never get, right?
Yeah.
Absolutely.
They get a peaceful, quiet, surrounded by love way of going. And I think that's a huge aspect of this field. I don't see euthanasia as a negative part of our field at all. It's a privilege, it really is.
Yeah, I actually agree with that wholeheartedly. I think by definition, pets are still property.
Yep, they
So
are.
when we get pets, and I try to tell people this all the time, it's your responsibility. And again, alluding to what Amanda said earlier, we are their voices. It is not okay to hold on to your pet, who will hold on as long as you want them to, and to see them suffer for your feelings.
Yeah.
I don't think that's fair. And I hope you all hear that and receive that message here from people who are who care and dedicate themselves to helping your pets. Sometimes the most heartwarming, caring thing you can do is let go. And that's not for every case. That's not for every case. This is not law, but this is an strong opinion from professionals.
And it's hard. Absolutely. It's the putting, having to make that decision for my pets have been some of the hardest decisions I ever made. And to be honest, like I didn't know that I would be able to make that decision at the time that I needed to make it. But I was surprised at how easy it was for me to put myself or to take myself out of the equation and just think about my pet, the one that I love so much, the one that deserved better
Yeah.
or deserved more than so and it's hard to think that way. And I know that I'm have a unique perspective because of my job, for sure, absolutely. But I think that it's good to try at least, to hear that sort of perspective and to try to incorporate it into your own life, even if so.
I love that. Thank you for sharing that,
Mhm.
both of you.
Mhm.
I think this is a great opportunity to ask this question. What are some surprising things people don't realize you have to know as a vet tech?
People are always surprised that we place IVs, that we intubate,
Yeah.
that we induce anesthesia, that an animal is put on monitors, that we monitor blood pressure or heart
Run
rate.
the
Like
gas.
it's always,
Mhm.
yeah,
Yep.
it's always surprising. Not always. It's a lot of the time. A lot of people are very surprised that the medicine that we practice is so close to what humans
Yeah.
get.
Yeah.
Sometimes, to be honest, I think that some of the medicine that we practice is a lot more humane sometimes.
Yep.
Yeah.
So,
Oh, definitely.
it's so I think that a lot of people are really surprised to hear that everything is that we do so much to make sure that we take good care of their pets and and our patients rather.
So true. How important is communication between the techs, vets, and even pet parents during a crisis?
Oh my gosh, like insanely important.
Yeah.
Could not be more important. From the communication, being able to convey to an owner, what's going on, especially in a critical moment, and for them to be able to understand what you're telling them,
Yeah.
and also for a technician to be able to communicate with the veterinarian, like, hey, I know it doesn't look like this is what's, but I have a very strong feeling that this is what is happening, or, he's giving me this kind of like communicating the things that you see and the things that, your feelings, your, vibes, for lack of a better word,
Mhm.
about what's going on is really, really important. Communication is like one of the number one things, needed in a veterinary hospital team. Like being able to talk with your teammates and your technician and your doctors. I mean, honestly, we're all one team.
Yeah.
Doctors, technicians, receptionists. We we're all one team. So, we have to talk to each other, letting each other know what's going on, even if it's just about stuff between, in our lives or, et cetera. So,
I'd like to just like take this opportunity to say this to each and every one of my veterinary professionals in the world. We need to do a better job at making sure that we actually respectfully communicate with each other.
It makes a difference.
From day shift to night shift to swing shift, from receptionist to the back, we do a dang good job at what we do, and we need to take pride in that. And that starts with each and every one of us treating each other with the respect that we all deserve.
Yeah, we all need each other to do our jobs. Period. We could not do our jobs without each other.
Yeah.
Not a single one of us.
I love that this field is getting farther away from that competition. Like,
Yeah.
I don't know if you guys remember going back, 10 years ago, even closer than that. It was very much tech against tech, who can fight to get to the top.
Yeah.
And I've noticed that, especially in the newer generations, a lot of that is starting to go away.
Mm.
And it is becoming more of a, we're all going to climb the ladder and nobody's going to pull it up behind them, right? Like,
Yeah.
we're all going to go up together, and we're all going to use each other's different experiences and skills and strengths together versus pointing out each other's faults.
Yeah.
Which is a big thing.
That's huge, and that's how we actually move forward.
Yep.
Yeah. What's one big misconception people have about your job?
Well, there's the old puppies and kittens.
That's my favorite.
The old faithful. The old faithful. I mean, people are like, oh, it's fun. You just played with puppies and kittens. And yeah, I do sometimes.
Yeah.
Less an emergency than I like. But, than your standard kind of general practice situation. But I mean, it's not all fun and games by any means.
Yeah.
But there's lots of cute babies to snuggle on. I think that people think that it's either they either think that it's really, really an easy, super, super easy job, or it's a really super horrible, hard, excruciating job. And I don't think that it's either one. So
yeah,
I think we're somewhere in the middle.
I
So,
agree with that. It's day by day, right?
Why do you believe your role is crucial, not just for the animals, but for their families too?
I said, we're their voice, we're their advocate. We're the ones who are, touching them the most, we're handling them the most. I can say to an owner, a pet parent that, like, hey, so and so, it seems so much brighter today, seems so much happier. I think what we're doing is really helping. Or, hey, this pet is just, not like it was yesterday. It seems really, uncomfortable. It seems unhappy. Seems, whatever. And being able to kind of convey that to an owner or to the doctor or, whatever. It's a unique role that we have, that we're the ones who have that much contact with the patients.
Yeah.
That we're the ones we see, when they look different from hour to hour. We can have an idea of, when a pet is in pain this hour, but 4 hours ago wasn't, or, et cetera. So.
That's amazing. I mean, so many good tidbits here. What do you love to do when you're not saving animals?
Sleep? No, that's not a thing. I mean, I don't know. I like hanging out with my friends, or just kind of try to decompress, I suppose.
Yeah.
Shop.
There you go. Final thought. What's one thing you wish everyone knew about veterinary technicians?
That we work our tails off, beyond what anyone usually, I feel like, typically does in a job that we stay late, or we lift things we shouldn't, or we do those kinds of things because we care about what we do. We care about patients that we're working on. We care about the owners that, whose pets that we're taking care of. We are ridiculously hard workers and sorry, but not always compensated like so.
Yes.
You know,
sacrificing. I would say.
yeah, we don't eat a lot. We don't pee sometimes.
What is a life
Sometimes
for
we
you?
go a whole sometimes I go a whole shift without peeing. Or eating. Sometimes I just grab a handful of popcorn and that's what I eat for a shift. But it's okay. I mean, not constantly, but it's okay in that moment because I saved, Jojo, or I noticed that Jojo was, not breathing right or, etc. because I was there to see it, to
Yeah.
pay attention.
Yeah.
So
That's amazing. Well, I have so much admiration for you and your work and what you bring to the profession.
thank you.
I appreciate knowing you and working with you. And I hope everybody takes the time to look at this interview and get to really understand some of the important things. Everybody really pay attention to what we're saying because you're getting it from the mouths of the people who are in the trenches day in and day out.
For a long time.
Oh yeah, it's been. I swear the years fly by
Right.
so quickly.
Yeah.
And then you blink, and it's like, oh goodness, where'd the last decade go?
Right?
Another thing I want to leave you with before we go is every hospital needs to be stocked with snacks.
Oh yeah.
Preach.
Yes.
And soda.
And soda.
Coffee.
And coffee. Thank you, guys.
Hey guys, this is Ryan from Athletic Conceptual Training. We're serving the Livermore area and we really want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content and we got more coming. We're one of the fastest growing company in the Bay Area and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see you soon.